Public Infrastructure, Environment, and Sustainability, our PIES Committee, call to order. Welcome, everyone. Could I get a motion to approve the minutes?
So moved.
Second.
All those in favor?
Aye.
Aye.
Opposed? Great, thank you very much. Looks like a short, I always say that, looks like a short agenda, but sometimes it doesn't turn out that way. The first thing up is the interim zoning ordinance, and Amanda Beck, would you like to come up and brief us on that? We've given you 10 minutes. Or Spencer.
Or both.
Kind
Or
of
both.
kind of a tag team
All right.
effort here. Okay. We'll try to move quickly. There's a lot here, but I know we only have 10 minutes. So the building opportunity and choices for all. I think you've all individually heard. Oh, we have to share the. Got it. I think we've all had an opportunity to connect with you individually about some of what's going on here. So we'll run through, I think, some of the background information and then get to the actual changes that are proposed. So is it gonna, there we go. Up to this time, a lot of our conversation around housing is really focused on a continuum of housing options, ranging from single-family homes all the way up through larger apartment buildings. Today, we kind of wanted to focus in on this segment of that continuum. This is part of what people often call the missing middle. But before we get into any of the specifics, I thought it would be helpful to highlight two important historical notes. So the first, this is a quote from a book called The Color of Law that deals with the history of racial injustice around housing in the United States. I'll just read the quote. Local and federal officials began in the 1910s to promote zoning ordinances to reserve middle-class neighborhoods for single-family homes that lower-income families of all races could not afford. The context for this is that in the wake of a Supreme Court decision called the Buchanan decision that outlawed the practice of racial restrictions on who could own property where, city officials essentially began to ask, are there other ways that we can prevent certain types of people from living in certain types of neighborhoods? And one way that they did that was by imposing zoning requirements that would make housing more expensive in some areas. And that had a natural effect of filtering out people that some people didn't want living near them, essentially. So that all arose in the early 1900s. This isn't a new phenomenon or anything. But I think it's just important for us to acknowledge that we're sort of living with the legacy of that undergirding our approach to zoning from the very beginning. The other historical piece that I wanted to highlight, this is a chart that shows the historic growth of the census population in the city of Spokane from the beginning in 1880 to 1940 on the right. I want to zoom in on this period right here, 1900 to 1910. This was the most significant growth period in the city. We added 70,000 new residents. Our population tripled from about 35,000 to about 100,000. And we created some of our most beloved neighborhoods, Browns Addition, Cliff Cannon, South Perry, Logan. There are probably a few other places that aren't even on that list. That all happened during that period of time. At that time, a variety of housing was just a natural part of how neighborhoods were built. That is the strategy that we used to accommodate such a large influx of population. That also had the advantage of offering different pathways to build household wealth. You could buy a duplex and live in one half and rent out the other half to help cover your mortgage. You could buy smaller units or larger units in a neighborhood that provided your family with some opportunity. The point being that variety is really a way to provide opportunity for people. We know that that world of the early 1900s is gone. So I'm not suggesting that we go back to the world of 1900. But we think that that approach to neighborhood building can holds some lessons for us as we deal with our own housing crisis, our own influx of population. Currently, around 2/3 of our residential land is zoned for single-family homes exclusively. Single-family homes, by nature, are the most expensive form of housing to build because they use up a lot of land, and they also are more expensive to operate and maintain because you're not sharing walls, so your heating bills are higher and you're using more water to water grass, all those things. We know that we've reached a crisis point here, so none of this is really a surprise to any of you. In the wake of these changing conditions, the mayor made her proclamation of a housing emergency last year. You, as council, adopted the Housing Action Plan and added your own implementation plan that called for some specific steps to address our housing needs. So our progress to date, you'll hear from us again later today. We have some changes to our accessory dwelling unit code and also to our development approvals for short plats. So those are sort of our points of progress at the moment. But that took us the better part of a year. The Housing Action Plan was adopted in July. We're now in June. And we've managed to accomplish those two things, or at least bring them up to you for a vote. I wanted to highlight a little bit about our process in bringing those forward. From November through May, this is a list of all of the touch points that we had with the community in various forms. We go through a lot of process when we are proposing changes because we think it's important for the public to be involved and engaged and to have a say in how these changes happen. And so we are very deliberate and careful about finding as many opportunities as possible to be out in front of the public talking about this. I should also mention that this list does not include the entire Housing Action Plan process, which was its own set of outreach and lasted for a year. And this also does not include our Plan Commission workshops, which are open public meetings and also provide an opportunity for people to follow along. So we're out in the community a lot. That raises a challenge, though, and that is that our typical process takes a long time. It's really not equipped to deal with an emergency situation. I wanted to add that, and this is the top point, in the outreach that we've done up to this point, we've actually been out in the community talking about some different housing types, including duplexes and attached houses or townhouses. And so far, we've actually seen quite a bit of support. The image up there, and you probably can't see it very well from your seats, the image up there is one of the posters that we had at one of our market events. And the top question deals with whether duplexes should be allowed in single-family zones. We have 2 marks in the mildly disagree column, and then a number of marks in the mildly agree column, and then a lot of marks in the strongly agree column. That's not a representative sample, so I can't say that speaks for the whole city, but we were frankly surprised that we didn't see more opposition to this idea in the time that we were out in public talking about this. So these are conversations that we've been having. I wanted to share this quote. This is from the implementation plan that you adopted. In accordance with RCW 3678-390, enact an emergency interim official control ordinance expressly allowing for up to 4 units attached in any residential zone, along with necessary modifications to land use dimensional standards to accommodate these enhanced housing options. This is also from RCW 3670A-600. I'm not going to read the whole thing. Essentially, it is calling on Washington cities to authorize duplexes, triplexes, quadplexes, and so on as housing options in areas where they previously were not allowed. So our proposal is that this would be a pilot ordinance. The technical term is an interim zoning ordinance that would last for a 1-year period. That pilot ordinance would allow duplexes on all residential lots. It would also allow attached homes on all residential lots, and it would adjust the attached home dimensional standards to match our RTF zone to make them more viable for people looking to build them. It would also allow fourplexes on residential lots, subject to some constraints. And here's where we have some options that you can consider. So option A would be to allow fourplexes on all residential lots. Option B would be to allow them within a half mile of a designated center or corridor, or within a quarter mile of frequent transit. Option C would similarly be within a half mile of centers and corridors, or within a half mile of frequent transit. So that's basically just an expansion of the distance from transit. And then option D would be within a half mile of designated centers and corridors without the transit aspect. So those are the four options that we've kind of laid out for you to consider. Another change is that it would simplify the way that we round our density calculation, so that we would just round up in all cases. This would mostly impact infill projects where a developer, for example, is proposing multifamily housing. And if they get to 14.2 units in the density calculations, it would jump up to 15 instead of being rounded down to 14. And last, it would apply uniform design standards. Our development types already have design standards, but we didn't want there to be any confusion about which design standards would apply under the interim ordinance. And so we took parts of our existing design standards and brought them in as part of the interim ordinance. So that's mostly just for clarification. They should be standards that developers are already aware of and have worked with if they've done multifamily housing with us in the past. I wanted to show the maps so you can get a feel for the extent of these areas. So this is option B, that's a half mile from a center corridor or a quarter mile from transit. In a minute, I'm going to flip to option C, and you're going to see that expand a little bit as we go a half mile from transit. So that's what that looks like. And I can flip back and forth again if you need. And then option D, which removes the transit aspect. So I'll just run through those again really quickly. That's option B, option C, and then option D. And I didn't include a map for option A, but that's because they would just apply everywhere. As part of this, we would also, the state requirements are that for the ordinance to last for a year, we have to have some form of a work plan to show how we're going to get to permanent changes that address the emergency need that we're addressing with the interim ordinance. So that work plan would include continuing our engagement. We fully intend to be out continuing this conversation with the community. The goal here is to front load the ability to build housing so that we can address our emergency need, but then continue the conversation, and at the end of a year, we can then make those permanent changes that we already know we need to make, but that hopefully we can spur some housing growth right now. Another one is comprehensive plan policy LU 1.3 and LU 1.4, which we've been before you to talk about. This would give us an opportunity to evaluate those policies. We would also be making those permanent development standard adjustments, presumably along the lines of the interim ordinance, but that would, of course, be subject to the conversation that happens with the community. We would also look at updating our design standards, and we would be evaluating the results of this program in real time. So we can evaluate neighborhood impacts. We can look at equity concerns if there are displacement risks that we're seeing in certain neighborhoods. We can also take developer feedback and find out where they're having trouble building housing, and also just making sure that this program is actually successful at generating new housing. I want to be clear that other development standards will still apply. So our engineering standards, limits on setbacks and heights and lot coverage, our building code, and our parking requirements would all be applied as they are today. So this interim ordinance would not change any of those requirements. It's really a change in the number of units that are allowed in the building envelope that is given to you on your parcel. I also want to be clear that detached single-family homes will still be allowed and will continue to provide for the majority of our housing needs across the city. So the last thing, I just want to be clear that there are no silver bullets. This is a really complex issue, and there's a lot that's outside of our control, including financing, labor shortages, supply chain problems, and also state code in different forms that make it either harder or more expensive to build housing. Those are things we can't control, but zoning is something that we do actually have some control over. So we want to propose making a change in that area, and then during that next year, making permanent changes, again, as part of a community conversation about how we address our needs. So that's all of our presentation. I know I took a lot of time, so I apologize. If you have questions, I'm happy to take them.
You're fine. Questions, go ahead.
Yeah, not a question. I just want to say thank you, Spencer, for all the work and collaboration that you've put in on this, because it's a real important project and one that I think is coming together real well. So thank you.
Thank you.
Go ahead.
Yeah, I think there are a few issues where there's a ton of alignment in our body, and I think this is one where we find a lot of alignment. And so I appreciate all the efforts that you're putting into. I think one of the concerns that many people have, and maybe you could address it for them, is people are worried about their neighborhood basically changing overnight. Can you give some sort of projection on a realistic? If there are many changes that are happening in a neighborhood, what are things that can expect, and how slowly or quickly will that take place?
Sure. Well, the first thing is, as a pilot, this only lasts for a year. And if there are neighborhoods where we're seeing disproportionate impacts, we have an opportunity to go in and adjust on the fly as part of our kind of 1 year work plan. I think the economics of development are such that you're not likely in most neighborhoods to see significant numbers of teardowns, for example. If I'm paying $600,000 for a house and then I'm going to tear it down and spend another $800,000 on a duplex, you're not going to sell a duplex for $1.4 million. I'm a developer that's going to go out of business in that case. So where I think you will see an impact is in vacant lots, underused property, and also lots that are distressed and already subject to redevelopment pressure. And then the last is existing housing that used to be a duplex or maybe a threeplex that got deconverted at some point but could be reconverted back. So, for example, I live in a former duplex that's now just a single-family home. I don't have any plans to do this, but if I wanted to under this ordinance, I could go in and reconvert my single-family home to a duplex and rent the other half out. You may see some of that activity as well. But I guess the technical answer is that we don't really know exactly what those impacts are going to be. And so the advantage of this 1 year pilot project is that we can evaluate those impacts and then adjust and react as we need to.
The other thing I really appreciated that you brought up was in the time of real extreme growth in the city of Spokane, how some of our most beloved neighborhoods were built in that time. I think that's a really fun point and a way that we can actually look at the situation that we're in as an exciting time for the city of Spokane to adapt and overcome the challenges in front of us. So appreciated that. Thank you.
Thank you.
Anybody else? Go ahead.
So I had asked this of Spencer, we got this 1 year window. So developer has to get all their ducks in a row in the 1 year window. And how long does those permits last? Because they won't be able to build that quickly, I don't think.
Yeah, that's a great question. We wanted to move quickly on this because we wanted to hopefully take advantage of the remainder of this construction season and then also the next construction season. The ordinance itself would last for a year. As a developer, if I get vested towards the end of that year, meaning I've pulled my permits and I'm on the path to creating that housing, there is a limit to how long that permit can be out. Essentially, you have to be showing progress. So I don't know the exact time frame, and I don't know that our Development Services Center necessarily has a strict time frame, but essentially you have to be showing progress. So if, as a developer, I go in and get vested, and then I sit for 6 months and don't actually do anything, that permit could be pulled. I think it's generally a 1 year time frame that they use for that. So you could pull your permit, and then if you're in the ground under construction within a year after that, you would still be working under the terms of this ordinance.
Thank you.
Go ahead.
Just to confirm, there will be some communication or meetings with neighborhoods to make sure they understand this and
Yes,
that it's moving forward?
we will be at Community Assembly on July 7th.
Okay.
We've tried to minimize the process around this because, as I noted in our slide, we have a lot of process for our normal way of doing business. We didn't want to subject this to the same process. The whole point is that we're trying to get this change done to address the immediate need and then have that robust community conversation in the wake of this ordinance being adopted. So we will be at Community Assembly on the 7th. We haven't even discussed this with Plan Commission yet, and so we'll be meeting with Plan Commission, of course, and they will be part of that one-year process going forward. So that is that's sort of our map. We also are required under state law to have a hearing within 60 days of the ordinance being adopted. So the intent is for mid-September to be sort of a check-in point at which we can hear again from the community about any concerns that they're seeing with the program and share any results if we're seeing lots of permit activity, for example.
Perfect, thanks.
Okay, two things. One, I want to make sure people understand that, as you said, this isn't the panacea, and all of a sudden our housing woes aren't going to be solved, and it's not necessarily going to be an affordable option. So depending on, as you said, supply chain, labor shortages, all those things contribute to things costing more. So I want to make sure people understand this isn't necessarily an affordable option. Is it more affordable than single family? Perhaps in some cases, but not blanket across the board. And then the other thing, could you go back a couple of slides to one more? Keep going. There. Where was that taken?
This one,
Yes.
it's not here in Spokane.
Darn, I was going to move there. This is great.
Well, I wanted to provide some pictures of what we're hoping to see.
Yeah. Okay.
Yeah, I think that one's actually from Maryland, but I'm not 100% certain.
It's very cool. All right. Thank you. Any more questions? Yes.
Sorry, can I just comment on the affordability thing?
Yes.
I'm glad you brought that up because I know we talked about it and I didn't include a bullet point in here. There's capital A affordable, which is like there's some kind of program around it. So that would be, for example, our multifamily tax exemption. And there could be cases where a house that's built under this ordinance could fit within that multifamily tax exemption and have some kind of affordability requirement. You also heard about our projects of citywide significance that would put an affordability requirement in order for city funds to be used for those kinds of projects. So in the work that we're doing that's tangential to this, related to financing and providing incentives, we're looking at how to introduce that conversation about affordability.
Yeah.
And your point is taken that it's expensive to build anything right now. So even a duplex or a townhouse may not be affordable to, in the sort of the broad sense that, somebody at 70% of median income is probably not going to buy into one of these new homes. But even providing those homes at the middle part of the range can help to ease the crunch on the lower part. I brought my prop that I think you've all seen, right?
Yes.
The ladder of affordability. As we provide more housing at the top, the opportunities then spill downwards so that people at the bottom of the ladder also have more housing available for them as well. So even though this isn't really addressing the bottom rungs of the ladder directly, there is probably some indirect benefit.
I just want to make sure we're not conflating this interim zoning change with the incentives that we've done. They're two separate
Yes.
things. Make sure that we don't conflate those two things with the public.
Yeah, thank you.
Go ahead.
Yep, I just wanted to also add my congratulations to getting something very specific and tangible. It was just about a year ago that we passed Council's Housing Action Implementation Plan, and these kinds of things were there, and super excited about your leadership and the revitalized staff that's there and getting these things out the door because, as everyone mentioned, this isn't low-income housing, but it is more affordable than the single-family house next door, the units of the duplex or triplex or fourplex. And I've, as I mentioned on Friday at the news conference, I accidentally bought a house in a block on the South Hill that allows all these options. And I would never have known it, and I still wouldn't, except that my neighbors tend to be a little more diverse than other people in the surrounding neighborhood, and it's just a great place to live. And I know, now that I know them better, they wouldn't be able to afford to live in my neighborhood but for these kinds of housing options.
Yeah. Thank you.
Spencer, thank you. Amanda, thank you for all your hard work. Appreciate it.
Thank you.
Next up, we have Lauren, who's going to talk briefly about hydrant, where are you? There you are. Hydrant lock update.
Thank you. Good afternoon, Council. We wanted to come back and do an update on where we sit with our hydrant locks. Or our system security measures. And briefly, because most everyone was around when we had our contamination issue, I want to cover a little bit of refresher on it as well, though. Oh, come on. Hold on. There we go. But now we lost. Okay. So back on July 26, 2019, we did have a system contamination. This is actually a water sample that came out of one of the taps. We went out and we found hydroseed was injected into the water system. When we went and investigated, we found major contamination in it. And some of the meters that we pulled out were completely plugged. We ended up having to replace services. What can't be seen on the right picture there is on the screens. We also discovered that this wasn't a first-time offense. It's something that had been going on for a while. Simply not to the same magnitude, so the customers didn't notice it. So we can tell the different layers of each injection that had happened by how far it had degraded over time. We did search around, and we found the hydrant. The hydrant was full of hydroseed. The ground's covered in hydroseed. We know that that was the injection point. And we went and actually did find a company that had been on that hydrant. So we narrowed it down. We do know how that contamination came into the system. For us, for the city, that meant that a portion of the water system was shut down for 5 days. This is in the Northeast Hilliard area. Luckily, it's an system-isolated area, so it was contained down to about 30 blocks of residents that were out of water, but they were out of water for 5 days. Ultimately, we spent 10 million gallons to flush the system out. Had to change 150 water meters. We dug and replaced 5 services that we couldn't get cleaned out. We had 96 accounts in that area that we ended up crediting back because of the loss of service. And we brought in 3 tractor trailer loads of bottled water that we ended up handing out. So it was a substantial effect to the system and to the citizens in the area. From that,
Before you go on,
Yes, sir.
did the company pay for that, or did we just absorb it in our water system?
We made an agreement with the company, and the city recovered actual costs
Okay.
incurred from it.
Okay, great. Thank you.
So we recovered the bottled water costs and the cost for the water meter.
Okay.
So we did make an agreement and did recover our firm costs off of it. From that, the water department and the city made a system improvement plan. We committed to better protecting the water system. We revised our hydrant use program from what used to be For all intents and purposes, if you wanted to use a hydrant, you came in and got a disc and you went out and used your hydrant. And it's far more restricted now. We've created the hydrant backflow meter cages. So all of our contractors now have these cages that they put out there. We have 160 of these cages built. Today, there's 136 of them that are being used. So it's an ongoing permit program. They take them out, they use them. It has the backflow assembly built into it. So no matter when they hook it up, they can't inject backwards. We set up a program to inspect all the public works trucks. So the city vehicles do not use this cage. They go out and they hook to it, but we've built in air gaps and protection within those trucks. And we regularly send our inspectors out to check each of those trucks to make sure that that gap still exists. And then they're all being connected the same way. So we train the employees how to use them. We started to build bulk water fill stations. We now have 2 fill stations. One is a public use station out at Garden Springs, and the other one is for the city vehicles. So at the fuel station, we have a fill station for all of the street department and wastewater trucks. And then we went down the path of getting the hydrant locks, and that's where we're at today, is starting to implement our hydrant locks on the system. Okay. When we went out, we found different versions of hydrants, locks. We set them out there, and we worked with 9 of the districts around us. And they all came out, and they messed with each of the locks and tried to determine what it was the easiest for the fire department to get on, the quickest for them to open, still provided hydrant security. And at the end, fire department needed to lock it back up again. So what ones they could physically figure out. Some of them had a lot more security to them, but were harder for any of the firemen to figure out in the middle of the night and limit losing pieces. This is the lock that we ended up with. This is actually a hydrant that's out at the fire training center. So we installed this one about 9 months ago. All the new firefighters that are coming through the academy are currently using this hydrant so that they have practice and understanding on it. We also have bought all the wrenches for this and distributed them out. So we worked with 9 of the districts around us. One of them being Fairchild does not have an inter agreement with us to respond to our emergencies. So they didn't get any wrenches for our hydrants. But all of the other 8 districts have wrenches on all their trucks now. So they can operate any of our hydrants should they be called into our areas. And the next is we're prepared to start installing these locks. The concept behind the fill stations is once that hydrant is locked up, then we wanted the customers to have the ability to easily get their water. Garden Springs Road is an old fill station, has a system on it, and anyone can go out there with an account and put in their account number and a PIN and tell it, I want 5 gallons, and the hose dispenses 5 gallons. They can tell I want 5,000 gallons, the hose will dispense 5,000. So it's very simple for them. We've had contractors out there using that for about 1.5 years now. It's very reliable. We haven't had any system issues with that fill station. So we're starting with the area right around it. We sent out a press release about 3 weeks ago that noted this area. This was chosen because the furthest point is about 2 miles from that fill station, so it's close enough to get to. And any of them out there can get on the fill station and use it. So we're going to start at the station and work out only into this area for currently until we get another fill station built. And then we'll do the same around that little area. So
Any questions for Lauren?
So Lauren, how long will it take to retrofit our fire hydrants with these locks? Because we're doing it citywide, right?
the plan is to make it citywide, yes. Currently, we believe this is probably going to be a 4-year plan. Simply on the timeline of building a fill station and then getting locks around that fill station and then moving to the next point. We're in plans right now with facilities and with street department to put a public station up at the ranch, which will then give us the ability to lock down that initial contamination area.
Any other questions? Council President? Lauren, thank you.
All right, thank you.
Appreciate it. Next up, we have a behavioral health specialist proposal, and Jan Takamoto is going to brief us. Jan, welcome. Thank you so much for coming. And just to kind of tee this up for everybody, I've been working with Craig Meidel for a while to bring more behavioral health specialists partnered with SPD, and Jan's been working with us as well so that we can add to and help take some of the burden off of SPD with using behavioral health specialists. So Jan's going to tell us about this program and then next steps moving forward, how we can get it implemented. So welcome, thank you.
Thank you. Good afternoon. I'm Jan Tokumoto, and I'm the Chief Operating Officer at Frontier Behavioral Health. Frontier Behavioral Health is the largest provider of mental health services in Eastern Washington. We serve individuals of all ages, providing outpatient services for, for therapy and case management services. We also operate two 16-bed evaluation and treatment facilities for voluntary and involuntary psychiatric admissions. And we also provide crisis response services for Spokane County 24 hours a day, 7 days a week. In addition to these services, we also have some specialty services that are geared towards the mental health population that may need additional assistance that some of our routine programs cannot provide for them. So I want to talk with you about this proposal. Sorry, am I not pressing the right thing? Okay. The question of why now? Let me give you a little historical perspective. Frontier Behavioral Health, years ago, we were known as Spokane Mental Health. At that time, we operated a crisis hotline, and then we transitioned that into First Call for Help. And then we are currently providing those crisis services through what we call the Regional Crisis Line. This Regional Crisis Line serves all of Eastern Washington. So we cover Ferry, Stevens, Pend Oreille, Lincoln, Adams, and Spokane counties. And we have trained crisis interventionists who answer calls from anyone within Eastern Washington, and we try to help them stabilize their current situation. About a year ago, we got involved with what is known as the National Suicide Prevention Lifeline, and we have operated that for approximately a year. Now, all of this lifeline is going to transition to what will be 988. That transition will happen on July 16th of this year. So we're just weeks away from this. And this is a national initiative. This is not just local to Spokane or to Washington State. The idea is that people will be able to call 988 and they will be able to get a live person who can speak with them about whatever concerns they have. It is really trying to target those individuals who are suicidal, but we know that people will call us because they're in whatever level of emotional distress. There are 3 hubs for 988 in the state of Washington. In Seattle or King County, it is Crisis Connections, and in Central Washington, the hub is Volunteers of America of Western Washington. And these two hubs have been in place for a few years. We applied for and were successful in being the third hub for the state of Washington. So we will represent Eastern Washington and again, those 6 counties that I mentioned. The other issue of why now is because attached to 988 is House Bill 1477. This House bill is proposing to restructure the entire crisis system within the state of Washington. So as a result of that, they've got 5 goals that they're trying to meet. The first one is that by January of 2023, they want people to be able to call 988 and actually be able to get a scheduled appointment with an outpatient provider. In July of 2023, they want to establish some best practices for how are we going to deploy these mobile outreach teams when people call and they need that face-to-face contact. Embedded within that is this concept of taking calls from 911 and moving it to a mobile team that can respond in lieu of law enforcement or other first responders. By July of 2024, they are going to determine a designation for these 3 hubs. And we will then follow whatever the certification guidelines are for that designation. There's a plan to expand the options for youth and adults so that they can receive immediate assistance when they are in some level of crisis. And then there is a huge effort towards technology so that we can select the right platform so that all of the 3 hubs will be able to report data and also be able to extract that data out of the system. So when we look at our relationship with 911 currently, Frontier Behavioral Health has worked with 911 for several years. We have designated crisis responders who are part of our 24/7 crisis response services. So we have a relationship with them in that way because there are times when we need assistance, when we need to take someone into our custody so we can evaluate them for the possibility of involuntary psychiatric inpatient treatment. Our regional crisis line, we currently work with 911 because of Lifeline, when we have those situations where we have someone who is imminently at risk and in the process of a suicide attempt. And so we call those active rescues. So we connect with 911 so that they can get whatever first responders are needed to that individual. With our crisis response services, we connect with 911 because there are mental health emergencies. And so oftentimes we're connecting with 911 because they have someone that they believe needs an evaluation for possible involuntary inpatient psychiatric treatment. And then we connect with them also because we have a mobile community assertive team, or MCAT, and then we also have a mobile crisis response unit for our True Blood clients. I don't know if you're familiar with True Blood, but it was a class action lawsuit that was brought against the Department of Social and Health Services in Washington. The Disability Rights of Washington contended that there were people who were remaining in jail and unable to get competency evaluation or restoration in a timely manner, and that was a violation of their civil rights and a violation of due process. So there was a class action lawsuit that occurred. Judge Peckman collected millions of dollars from the state of Washington because Eastern State Hospital and Western State Hospital were not able to get people into evaluation or restoration in a timely manner. Those dollars were then taken and returned to the communities with the idea that we would figure this out and we would be able to assist people in a timely manner and divert them from the criminal justice system as well as emergency departments and inpatient psychiatric treatment. So I wanted to give you a little bit of information about Frontier Behavioral Health in terms of the populations that we work with and why we are a good fit for this 911 proposal. As I mentioned, we operate the regional crisis line. And with 988, we provide that intervention for people who are suicidal. And we cover the same counties in eastern Washington that we do with the regional crisis line. We will cover that also with 988. You may be familiar with our co-responder teams. We currently have 11 of them, 7 of them with the Spokane Police Department and 4 teams with the Spokane County Sheriff Office. And we've been doing this since 2018, and this is part of that True Blood class action lawsuit, the funds that supported this. And you can see we've had over 6,800 contacts. We've got a diversion rate of 61%, where we're diverting people from the criminal justice system, emergency departments, and inpatient psychiatric care. Under the first contract that we had was with Disability Rights of Washington, and then our current contract, in addition to that one, is with the Washington Association of Sheriff and Police Chiefs, or WASPC. We've only had 44 arrests under our WASPC contract, and out of that contract, we've seen over 4,000 people of the 6,800 contacts that I mentioned. And we've also had 0 uses of force beyond handcuffing, and I think that's phenomenal. Frontier also has what we call a Reentry Community Services Program, or RCSP. These are individuals who have a mental illness. They're from Spokane. They are currently in prison, and they are coming back to our community. So we have a program that is set up in partnership with Department of Corrections so that we can bring these individuals back into our community and ensure that they have the appropriate mental health care. Same concept with the Mental Health Sentencing Alternative Program, but that is based with our local courts, so that if someone is currently incarcerated and they are interested in receiving mental health services, then they can be taken out of jail and brought into care with us on a court order in partnership with Department of Corrections, so we can be sure that they get the appropriate care. Frontier Behavioral Health, as I mentioned, that True Blood lawsuit, you can see that we have 7 contracts under True Blood. We are the only agency in all of Washington State that was successful in getting all of these contracts. If you look throughout the state, these contracts are with various providers, which makes it a lot more challenging to provide a continuum of care for these individuals. What I'm proud of all of the contracts that we got, but the one that I'm really proud of right now is that housing contract that we just received last year. And this has allowed us to, in partnership with Catholic Charities, to build a 24 apartment unit for True Blood class members. And it has also given me the opportunity to contract with Pioneer Pathways for 10 apartment units, so we can house these True Blood class members until that 24 apartment unit is built. And that should be opening in October of this year. I mentioned the Mobile Community Assertive Team, or MCAT. These are individuals who respond to people that are in crisis. We are adding a child, youth, and family mobile crisis team. We are in the process of hiring those staff. And I mentioned our crisis response services. That is a 24/7 service. And we have been involved with law enforcement way back 20 years ago with our CIT, or Crisis Intervention Team training. And till this day, we train side by side with them. So this mobile unit that we're proposing, I spent some time with 911 last year, and they gave me some data from 2016. And you can see the number of calls that they get, and I know for a fact that those calls have increased significantly. And in speaking with them, they thought that there were probably about 10 to 20 calls a day that could have been appropriate for this mobile team. This team I'm talking about, there would have to be some screening so that we're sure that the staff we send out to respond to these crises are safe. And so part of the criteria would be that the person is not currently violent, and if they have a history of violence, then we want to know the extent of that and the possibility that they could be violent again. And I'm talking about verbal and physical violence. That there are no weapons present. We would be screening for that as well. And that if they are using substances, that they still are able to converse with us, because if they are actively using substances and cannot participate in an intervention with us, then they probably need a higher level of response. And that there is no need for medical response. So what we proposed was a unit that would be exclusively for 911 referrals, and they would operate Monday through Friday from 10 to 7 at night, and then you can see the staffing. Now, the thinking behind this is I already have that Mobile Community Assertive Team, or MCAT, and those staff operate 7 days a week, and they operate from 8 in the morning till 11 at night, Monday through Friday, and Saturday and Sunday from 8 in the morning till 7 at night. I would want to take this 911 team and embed it within the MCAT team, because what that would do is it could potentially double my numbers in terms of staff who could respond. Training would be really important for this team, and I would want to train the staff with 911, Crime Check. You can see all of the different entities involved here. And train them specifically on things like motivational interviewing, which is a best practice that we're using now with our co-responder teams, and harm reduction and mental health first aid and these other trainings I've listed. So why now? Well, I really want to look at the appropriate use of resources. If there is an opportunity that there are some calls that really don't need response from law enforcement, then why not move it to a team that can provide that appropriate response? I'll give you an example of what I'm talking about. When I sat with 911, there was a gentleman who called in, and it was wintertime, and he called in and he said, "I need help." And they, "Sir, what kind of help do you need?" "I'm cold." "Sir, is there any medical issue going on?" "Nope." "Are you currently at risk?" "Nope, I'm cold. Send me someone now." They dispatched someone to this man. Within an hour, he calls back and he says, "I need help." And they say, "Sir, we dispatched someone to your location, but we couldn't find you." He said, "Well, I left, but now I'm back. So send me someone." Again, "Do you have any medical concerns, etc.?" "No." That's the kind of call that would be appropriate for a team like this. Building community trust, having people that have experience providing this type of outreach service so that we can connect with individuals and hopefully talk with them about using us instead of calling 911. Law enforcement, allowing them, by taking some of these calls off of them, allowing them to focus on preventing and investigating serious crime while we work with the mental health population that can use our services. Dedicating this mobile team to 911 so that we can create this partnership so that we can be successful with these calls that we're taking. And you know, the one thing that I really am interested in, if with 988 moving in the direction of those 5 goals I talked with you about for 1477, if we were to do this, this would give us an opportunity to lead the discussion with the rest of the state about what is possible and what things you need to watch out for in order to make this work in your own community. So much of what I experience in this initiative is a lot of things are set by the west side of the state. And a lot of those things are not a good fit here in Eastern Washington. And I think this gives us an opportunity to lead that discussion. And it gives our citizens the chance to receive timely and appropriate resources from this mobile team. Thank you. Do you have any
Thank you.
questions?
Who has questions for Jan? Go ahead, Councilmember.
Hi, Jan. I think this is the first time we have ever really met face to face.
Yes,
In all
I
these
think
years.
so. Yes.
Welcome. So my question is, there is a lot of money dedicated at the state level around mental health and funding issues. Would not this program fall there, or are you looking for a specific partnership with the city for ongoing sustainability of the program? That's question one, state money, and then partner with us for sustainability is the
You
second
know,
one.
I think it's a combination of both. If we could have this partnership with the city and put this in place, then if there is the opportunity and 1477 does incorporate a component of 911 moving calls to a mobile team, then it would relieve the city of having to deal with the sustainability of this.
So I'm excited, but I know I have spoke with your CEO that, as with all mental health facilities, every new program that comes on thins the ranks around mental health providers in a significant shortage. So my challenge is, this is needed, but what's your pipeline that you have in place now to meet your current needs in addition to bringing on a new program?
You know, we've done several things around recruitment and retention, and we've made some headway. I can tell you that we have been successful in recruiting and retaining staff to where the percentage of our vacancy rate has dropped. And we still, but we're not out of the woods yet. One of the things about this proposal is that I want to embed this team within my current MCAT team. It is a solid team. I have very little turnover. And if I can embed this team within my MCAT team, if I only hire 2 staff to start for this 911 proposal, I have 20 other staff already sitting and waiting. So I could take those 2 staff from this proposal and put them together with my MCAT team, and now I have 4 teams that could respond.
My last question. So where would you house this 988 team? Would it be?
988 is currently housed out in a building on Argonne Road. My plan is, if this were to go through, I would house this team where my MCAT team is currently located, and that's out on Lidgerwood.
Thank you.
Other questions?
So I had a couple questions. One of them was as well staffing. If we gave you all the money in the world, could you actually get the staffing necessary? And I know that you said that you're not out of the woods. How long would you foresee it taking to be fully staffed? If money wasn't an object, how long would it take?
To be fully staffed,
Yes.
I think you're looking at months to be, to get the staffing and continue to add. I think we would be successful in getting some staff right off the bat. That child, youth, and family mobile team that I mentioned, we just advertised for that. Probably in the last couple of weeks, we've already hired 2 people. So I think it's really about, people having an interest in this, what the workforce is like, and then us being able to just continue to add over time. We have, as was mentioned, there's these dollars that came from the legislature to help us with our workforce issues. And so our staff at Frontier just received an increase in their salary, and I'm hoping that will help to attract people as well.
If you have any silver bullets on retention, we at the city would like to know about them, because we're working on some staffing issues ourselves. But you were talking about True Blood members. You built an apartment complex with 24 units. How many people are in that designation that you're dealing with?
There are a lot. And one of the programs that was up there is our Forensic Path program that program is designed specifically to find these people, because there are probably a couple hundred of them, but they're all not known to us. And so we have a program that tries to find them, and then I have a housing program, so when we do find them, we can actually pay $1,200 a month for 6 months for rent and any other, costs, so that we can get people housed.
Council President.
Yeah. Hi, Jan. So great to see you and hear about this. Two things. One, I read about the STARS program in Denver, which sounds similar to this. And they reported recently that it not only helped people and avoided jail and hospitals, but actually reduced overall crime significantly, I think. So, and I know that several of us have been working on this idea. How soon, understandably, if you staff up a couple positions at a time, is 911 ready to start sending us referrals?
If you were in agreement with this, then my first thing to do is to sit down with them and sit down with the chief or whomever he designates, and probably with the fire department as well, and have that conversation about what does this look like, how do we train people so that we get the right kinds of referrals and that we're not placing our staff at risk.
And then if you were going to make a preliminary ask for, I mean, you don't have to do it at this moment, but we would love to hear from you sooner rather than later, like, okay, if you gave us this much money, we could hire this many people and get started. Because I really do think in all the conversations I've been in, whether it's with police or community groups, this alternative response for nonviolent situations seems to be the common ground that everybody wants to do and is most effective. So we're very interested. So.
And I have submitted a budget, and I would be happy to take that budget and look at, what would be phase 1, 2, 3, et cetera.
Councilmember Stratton, and then Councilmember.
I think I have 2 quick questions.
Okay.
So this is, I just want to make sure I understand this. So this is calling, so somebody's calling in, getting a mental health professional to kind of assess the situation and either go to where that person is to assist, get them where they need to be, that kind of thing, right?
Yes, the call would originate at 911. They'd be trained on the criteria to move that call over to this
To this one.
911 team, yes.
Okay.
And then it would be what we call a warm transfer. So 911 stays on the line, they move that call to us. I have dedicated phone people who would answer only these 911 calls, so I can assure them that they will get an immediate response. Then we take that warm transfer, and then we start talking with that individual, and then we work out a plan with that individual to come to wherever they're at, so we can see them and provide whatever services and resources are needed.
That's great. My second question, as you were talking, I kept thinking about Camp Hope and where we're moving in this homeless situation and what we need to do for people. Is this a program that could possibly be used or accessed to, right now we have people living that we don't really know what we're dealing with in that whole camp. We don't know mental illness, substance abuse, people that are been priced out of their apartments. We don't know what their issues are. So is that a situation where we could use a program like this to literally go there and start assessing people and grabbing the ones that we can get help for immediately and getting them?
I have other programs that could
could do
provide the
that?
type of service that you're asking about.
Okay.
Yeah. We have a homeless outreach team.
Okay.
We have our MCAT team. I also have a mobile crisis response unit that is specifically for True Blood. So there are other resources, I think, that are well-suited to do what you're asking about.
And do you, just in your experience, think that in a situation like that, so figure 400 campers, that we could have specialists in there talking to people, and that we would find those that have mental health issues that could be assisted and taken out of there and placed somewhere else than the camp? I mean, I don't know what the rate of,
You know, we have resources. With my co-responder teams, I built into the contract that I could have shelter beds that were available. And so we could move some people out of that if they were interested in a shelter bed. If they were a True Blood class member, then they would qualify for a lot of these resources that we have. So, you know, it depends on their circumstance and their willingness
Right.
to participate and be linked to these resources.
perfect, thank you so much.
Last question, Mr. Cathcart.
Yeah, you mentioned the phone call that you observed, the gentleman who was cold, and I'm just curious, do you happen to know, are there any numbers on kind of an average number of calls that are sort of benign like that in a day, a week, a month, something that would give us some sort of estimates to operate under?
The best information they gave me was about 10 to 20 calls a day could probably be moved to this team. I think nationwide, they look at about 25% or better
Okay.
of the calls that come into 911 that could actually go to a mobile team like this.
And are there guidelines for the team members who would be responding to protect them if they get there and the situation is maybe different than was thought on the phone?
Absolutely. I'm glad you brought that up, because what I would build into this program is that if we go knocking on someone's door and we can tell immediately it's not quite what everybody thought it was, then we would back away. We'd call 911 and let them know that we really need officer response or medical response.
Okay.
And Jan, that is your practice today, correct? For your outreach teams, that is your practice today?
Yes.
If they're in a situation, they just call 911 for backup?
Absolutely.
So
yeah.
that would be a continuation.
Okay, so,
And you know, we also have a co-responder team with the Spokane Fire Department.
yes.
So these connections have helped us to really think through what a team like this could be and what resources we can also bring to support them.
So next steps, I'll be working with you to get something put together so that we can bring it before, on an advanced agenda for approval. So stay tuned.
Okay, thank you so much.
And appreciate your time and your hard work, so thank you very much.
Thank you.
Next up is a draft proposed camping ordinance discussion. Council President, myself, I know Mary Miramatsu and Margaret are in the audience. Did you want to come up in case we have questions? Thank you for being here. Just to tee this up, I started working with Mary on a riparian rehab, anti-camping. Before COVID, we have a camping ordinance currently that's not enforceable. It was done about the same time that Martin v. Boise was passed or was ruled on. And so here we are with an ordinance that is not enforceable because of Martin v. Boise. So it was really long overdue to open this up and look at it again. And so here we are. We've made many changes already. We're not at our 47th draft yet, Mary, so we have a little ways to go. But can you just give us kind of an overview? I'm going to turn it over to Council President after. Give us a little overview of what we're looking at and some of the goals that we wanted to see going forward.
Yeah, absolutely. Good afternoon, Council President, members of City Council. It's good to be here. Margaret and I and Lyndon have all worked on a draft proposal for several of you. And I want to thank all of you for being willing to engage in this conversation. I know that each of you has your priorities, and it's our intention to put forth drafts that ultimately you all will decide on what the appropriate policy is for the city. But what we have prepared are different drafts that each of which would be enforceable in ways that are not currently enforceable. Right now, we are wedded to the Martin versus Boise analysis. We either have shelter and can enforce, or we don't and we can't. And so I think what we're looking at is providing you with some options that will allow you to allow the police department to enforce, at least in some locations, regardless of whether or not there's shelter capacity. And we're relying, and Margaret can speak better to this than I can, but we're relying on the very verbiage of Martin versus Boise, where the Ninth Circuit recognized that while it's important to provide shelter if you're going to criminally enforce, that a city doesn't have to do that in every single location at all times. And there's a famous footnote 8 in one of the Court of Appeals decisions in Martin that actually allows cities, at least the way we've interpreted this, and there's a number of interpretations, and including from our friends from Tonkintorp, who've provided really good analyses that tell us we're not saying that the city cannot enforce in some places and in some locations. So what we're hoping to do is to at least give you some options and to give you a template. And I think that we've done that, and we just want to be helpful. But essentially, the template would be as follows, that in some places, city properties, for example, that would be subject to Martin versus Boise. Camping would not be prohibited on city properties. And then in other locations, the locations of your choosing, there would be per se prohibitions, and those would be the locations that you would decide what those are. And in these particular locations, it's never appropriate to camp. And in the third category, it would be strictly pursuant to where it's unsafe, wherever you deem, or wherever a police officer or a code enforcement officer or other city officials can determine there's an actual safety concern, something that substantially harms or poses a danger or threat to the public, that these would be based upon the facts and the evidence before the court, that an officer could persuade that court that in fact it was appropriate to enforce. So we're giving you different tiers of enforcement, and that's what we've put forth as we've met with each of you and have discussed this. So,
Great, thank you.
Yeah.
Council President, do you want to go through, and you and I have discussed this with Mary, with Margaret, and what are the things that, the meat of what we're proposing?
Yeah, and I think if you've got your email, I sent the latest version after we met with them late this morning of that. So I think the challenge is people were a little bit hopeful based on the law firm that lost the Boise case that this one footnote, you could simply write the magic words and there would be no homeless people camping in your city or functionally anywhere. And that's just in my point of view, that's not going to be effective. And instead, we're going to be the next Boise v. Martin, going up to the Ninth Circuit and spending all the money to do that. And so I was trying to work with Councilmember Kinnear and our legal team to find out how could we really, stay within the Martin v. Boise, but make it more effective, because the last ordinance we did was before the Ninth Circuit decisions came down. We knew there was a trial court decision, so it informed us, but we weren't quite spot on to it. So what this tries to do is say, we're not going to criminalize camping for homeless people if there's no shelter beds available for that person. So right now we don't really have beds for women, for instance. But surely there are some certain situations. If someone pitched a tent in the street, we can't do that. And that seems to be what that footnote is saying, is that there are locations where you could just say, no, you can't camp there. But they have to be pretty narrow, otherwise it sort of swallows the rule and then the whole thing gets struck down. And so that's the balance. And depending on where you live and where you have a business, you would probably draw it, no camping in my neighborhood or no camping outside of my business, but you could do it someplace else. And so we tried to simplify things, and we came up with two things. One, some very specific things that people have looked at, which is actual developed city parks, given how much people are using that and how much, not just for the people who are there, but also just the landscaping there of what camping does to that. Secondly, right by the river, we've got huge problems with garbage and things like that getting into the river, and no bathrooms there, and then so close to the river, 35 feet from the river. And then the third is probably going to be the most controversial, but I think it is defensible, and that is the railway viaducts downtown. We would designate which ones that right within those are such a pinch point for people walking and traveling through, and there's traffic right there that people can, so it's that we do those. But as Mary mentioned, that we designed a catch-all provision that would apply anywhere in the city, whatever neighborhood you lived in, whatever business district. And that is if an officer can document that there is a substantial risk of harm or danger to people, they could say if there was just kind of a precarious situation, they could enforce it. That could be close to other shelters, child care centers, business districts, all those different things, if they can actually document as opposed to just have it per se. When we looked at the map from the per se of all the different categories that people had suggested, there was essentially very few places someone could go, and they were in the neighborhoods. And it just, in my opinion, that would not be defensible with the court, and we would lose the entire system, plus be subject to damages and things like that. So that's what it's intended to do. And again, this is just a discussion piece, and we're introducing it publicly, and I know other people have different opinions.
And just to be clear, downtown is a neighborhood. We have 29 neighborhoods, and the outlying neighborhoods, certainly we don't want to push this problem around, as you and I have discussed. We want to try and get people to help, try and get people to shelter, but when you designate those zones, as you said, we're just moving the problem to different neighborhoods. And so this was an attempt to actually try and solve the problem as best we can and not move it around and designate those areas. And I think the one thing that we did agree on, Mary Margaret, correct me if I'm wrong, but a substantial harm piece, I think is really important to this because it does give officers that leeway and they are able to enforce wherever.
I think that's right. Officers are noticing this all the time and receiving complaints from members of the community who are showing them. And of course, where there are ample instances of documentable damage, critical infrastructure that's being damaged, bridges that are being dug into, trees that are being set on fire, and things like that, foliage that's being destroyed by the riverbank, things that are happening, including in downtown, on sidewalks, in front of buildings, and things like that, that do in fact pose a danger to members of the community and shouldn't be there. And so I don't doubt whatsoever that officers would have ample ability to document, when there is something that they see and can clearly demonstrate poses a substantial risk of harm to the community or danger to some person. So I don't think that's a concern at all. And if that stands separately from those per se restrictions that you all impose, then I think that could be very defensible. And what it doesn't do is what our current ordinance does, which is outlawing camping everywhere. And I think that's what Council President Beggs is saying. I agree. That would not be defensible. It isn't currently defensible to say you cannot camp on any public property within the city of Spokane. That's what we have right now. And so unless we divorce that from shelter availability, we're not going to be able to get anywhere with that. So that's clear.
And during our conversation, you indicated that right now the police don't have tools they need to actually enforce or get any headway on this.
They are very, very limited. And so, yes, they need the additional tools that the approach that we've set forth would provide, which is allowing them these different tiers of enforcement. Absolutely.
Okay.
Yeah.
We're not done yet,
Yeah.
but go ahead, council member.
Yeah, so I was just going to bring up that Councilmember Bingle and myself have introduced our own version of a public camping ordinance, and we weren't able to put it on finance today to have a hearing, so we will be putting it on public safety, and we do plan to have a vote on it. And it is substantially different from this, I think in some meaningful ways that will allow us to actually enforce in areas where we need to. And so happy to have that hearing on the 11th and then vote soon after that. So I just want folks to know that, and that has been distributed to all of council and is available for public comment.
Absolutely. And we want to thank you as well. You are one of the council members that we worked with. And again, these are your priorities to determine as a legislative body. There were many, many good ideas by all of you. And so we really want to commend you for the discussions. And these will be priorities you'll have to settle on. So
Go ahead.
So is there any way that we could take the two and work out something that works for everybody?
Well, I thought that's where we were going, but we kind of went in two different directions, so we'll see.
Yeah, maybe, but we do have two different ideas of,
We're not far apart. If that's any consolation, I think they're very compatible, so
Okay.
for what it's worth, yeah.
Thanks.
go ahead.
My comment, as long as it's all legal, that would be my first thing. And this just kind of goes back to our conversation this morning about council having its own legal representation versus the administration, when we have these philosophical differences of directions that we should be going. I think this is the prime example of where we're at. But if we could meld the two, I asked this of our incoming attorney, interim, whether it's council or administration, it just has to obey the law. That's kind of what I'm saying.
Go ahead.
Oh, I just wanted to say the other thing, the solution for all this is a project that we are all working on and we're voting on tonight, which is actually getting beds. So that, the real cure for the ordinance and the Boise v. Martin is to actually have beds so people are not having to make tough choices. So.
Did you want to add anything?
No, I'm sorry, go ahead, Councilmember.
Oh, sorry.
Yeah.
Hi there. So we talked about giving the police more tools to be able to help, protect the health and safety of all individuals involved. In the most recent draft, we haven't been able to take a look at it. What tools have been given or provided to help the police in that way and help the community?
We just enumerated those. Go ahead.
Yeah.
So the main tool is that they can, in their reports, make findings of a substantial risk of danger or harm, regardless of where it is in the city, and use that to remove people. And then there's also an expedited removal of property in that situation, which is different than the other situation.
And then the other one would be identifying locations where, regardless of what the reason is, it's just simply illegal to camp there. So the danger, the per se, we're calling it per se restrictions because it doesn't matter why, it's just the city council has made it illegal to camp there. So danger, per se violations, and then the other, which is the immediate encampment removal. Yeah.
I know that as Councilmember Cathcart was working with some others on this, one of the things that was in there was within a half mile of a congregate shelter. We took out the definition of congregate shelter. We took out the provision within a half mile of a shelter. Is that because we wouldn't be able to enforce that, or was that just a decision we made as a body to remove that particular portion?
Those are your priorities. It is up to you all to decide where those locations would be. City Legal does not have a stake in this. We just want it, as Councilmember Wilkerson says, to be legal. And we believe it will be legal, no matter where you decide those locations should be. But there should be locations that you've decided are off limits for camping. The whole city cannot be a campground.
Right.
And so you have to decide where those locations are and make those illegal. And then we can enforce. Yeah.
So if we were to have a provision in this sit and lie that was, for example, a half mile around a shelter, that would be something that we could do if we wanted to do. That would be legal and enforceable.
Yes, it would be legal and enforceable. That would be your decision as a city council, right?
Well, I might add, it always depends on what your other prohibitions say. I mean, that's where the balancing comes in. If you prohibit camping in all public places, or
Right.
it looks like you are, whatever your prohibitions are tantamount to that, at a time when we don't have shelter, which is right now, then it's not going to be defensible.
Right. We can't make the entire city. You can't camp in all of it. It has to be a reasonable amount.
Although
yes.
you can if you have sufficient shelter.
Right,
You can say
right.
no camping anywhere, any
Yeah.
city property, if you have sufficient shelter.
Yeah.
Okay.
This ordinance says no camping city property. I mean, it says that basic thing. You have to have beds, but there is the challenge of, again, off of a footnote, how much can you add into the off limits before you cross the line where it's essentially, for someone who's just on foot, you've essentially criminalized them for not having homeless shelter beds. So I don't know that, I think, as Margaret says, any one thing by itself, if that's the only one, you probably, okay, maybe. But when you add more than one together and you start seeing the map shade out to it from someone who's on foot, then that becomes a challenge. And I don't think any of us could predict what's the straw that breaks the camel's back on that. It depends
Right.
on the judicial panel we get. But the question is, how close do we come to that line?
I just have one left. So how does this work, that we have two? do both go through a process. We've got two very talented individuals working on this on the legal side of it. So we have to publicly move both forward
If that's what,
because,
I mean, we're still talking about, this is
Okay, so
just the
we're not-
first draft.
so
that-
maybe from here on, maybe we could sit down and make one document and get everybody what they need?
Maybe.
But we have been meeting as a group.
We
So
have
we just
been,
haven't,
yeah,
we
we
haven't
just-
reached agreement yet. So
But it's
it's
not-
not that we haven't been meeting.
This is just
Okay, because
the
it
first
feels a
touch.
little awkward.
It's always awkward.
It's a little awkward.
Yeah.
I just hate to see all the time and
Yeah.
have one and be done with it.
Any other questions? Go ahead.
So then, Mary, both of you will be back when Council Member Cathcart and Bingo
Yes, of course.
present their ordinance. Okay, thank you.
Yeah.
Okay. Any last words? Any last words?
No, I just want to thank all of you for the conversations, being willing to work on this really important issue. I don't think we're far apart. I think all of us are conceptually in agreement with what needs to happen. The
Right.
details are yours as policymakers, and I do think we can get there. So, thank you.
I just want to quickly say thank you. I know that the legal team has been working really hard on this, and we appreciate all of your input. It's very valuable. Thank you very much.
Thank you.
Thank you, Mary. Thank you, Margaret. Appreciate
You're
your
both
time.
not only brilliant, but you're saints, too.
All right, we're adjourned. Next meeting is July 25th, and Les Pie's meeting, next meeting is going to be at 3:30.
I'm missing our regular 10 out of 10.